Please welcome Measure Conference Chair and Founding Chair of the first MFA in Social Design, Cheryl Heller.
Good morning and welcome. It's really hard to believe that after all these months of planning for this day and thinking about it and imagining it, that all of a sudden everybody showed up. So thanks for making it on a rainy morning. There are some things we have in common that have brought everybody here together, and one of them is the interest in human health and curiosity about what social design can do to improve it. And the second one, I'm willing to bet, is the challenge that we all have in explaining what social design is to people outside the field. It's hard, and we tend to use different language for it all the time. And I tell my students often that it may not be until sometime in the spring semester that relatives stop saying, "What are you studying again?" The high-level definition that we use is that social design is the application of design methodologies to solutions for complex human problems. And for somebody, obviously, who doesn't know what design methodologies are, that doesn't help much. It becomes a little more clear when we talk about the issues that we address, like poverty and climate change, planetary health, food insecurity, injustice, inequity, and obviously human health. But what exactly design is doing in that conversation is still a little bit hazy. It's a methodology made from familiar parts, the classic designer's ability to understand complex information and make that accessible to other people, of visualizing ideas and forces that are invisible, of giving things form or making, and of making new ideas desirable to people. And it's also made of some new ideas that are new to the contexts in which they're entering. First, that viable solutions come from within the communities in need of help, not from conference rooms. That we can't know what it's like to have the challenges we want to alleviate, and that only the people who do know what will work. That prototyping and observation are more effective than 5-year plans. That all social challenges are systemic, and that no intervention should be undertaken without understanding the system that it impacts. That participation in a collaborative creative process is a foolproof strategy for building agency and capacity. And we say that the process is the strategy. It's a not so subtle shift in approach and in power. And these are habits and power that are difficult for those who hold them to give them up. We know that social design can't be done alone, and it can't be done in theory. It has to be practiced on the ground in the rich and complex and evolving and daily more difficult to fathom world in which we live. Those of us who practice it or fund it or teach it or commission it have seen its potential, and big bets are being placed on it, not without reason or clear-eyed observation. But like life and all social change today, the field is still driven as much by what we don't know yet as what we do. So we're here to compare our experience and pool our knowledge and prepare the next practitioners to take it further and to scale those things that have earned the attention and the hope placed in it. Not everything that counts can be counted, they say. Health and well-being aren't transactional, and we don't want to reduce them to transactions. So how do we protect what's essential to the quality of life and health, but harder to measure? We need to be careful. And we need to be humble, because design isn't the answer to everything. It's only by combining diverse expertise and approaches that we have a chance of solving these problems. And we need to be realistic in the midterm and short term, and we don't plan to arrive at any answers today. We're starting a conversation, and it's our plan to continue that conversation as long as we need to arrive at some answers. The questions that we want to ask today are, what are the assumptions we currently hold about design? Where's it working, and how do we know that? And what are the next places to explore? So you know we've never done this before, right? We're actually going to try to design a conversation among the people on the stage and all of you. You're going to hear stories, and you're going to hear stories about people's, not just their successes, but what they're struggling with. Talks have been curated to illustrate the scope and the depth of social design, and also as broad a spectrum as possible of approaches and definitions of health. In Parts and Systems, Heather Fleming and Michael Murphy are going to cover new ways to think about design, from products to the built environment, physical things that are intended to impact the whole system in which they exist. In Measuring Moving Targets, Zoe Bespalko and Evan Thomas are going to talk about new tools for measuring design in use, and Anne Lafon is going to talk about measuring something that changes its trajectory midstream based on observations in the field. In Small and Big, Maggie Breslin's going to talk about working with individual patients to give them agency and improve their decision-making. And Sunday, Bridget Jones is going to talk about how to measure the health and resilience of an entire city. In Structure and Freeform, you'll hear from Doug Powell, who's creating a culture of design within the hierarchy of a massive global corporation. And Mark Brackett is going to talk about the social and emotional learning in the wild world of youth. In Digital and Analog, Jonathan McKay will tell us about the text-based program that he's developing that's helping hundreds of thousands of women across multiple countries in Africa. And Roseanne Haggerty is going to talk about her work in the neighborhoods of Brownsville and Hartford, restoring people to health and homes. And then finally, in Now and Then, Tracy Johnson's going to talk about her work embedding social design in the world's largest foundation and where that's headed. And data scientist Jake Porway is going to talk to us about how to use big data. So as you hear these stories, we're hoping that you will write brilliant questions and insights and then pass them to the people you may have noticed wearing one of these giant yellow boutonnieres. The provocateurs are going to channel your questions and insights, and they're going to represent them and you to the speakers on stage during Q&A. You have a sheet of paper that gives you a little background on each of the provocateurs. You will find that they're all extraordinary practitioners in their own right, and I'm going to ask them to stand up now so that you know where they are. So we have Lydia Andrawis, Sarah Tollefson, Karen Proctor, Tina Park, Jesper Christensen, Letha Filderman, Dean Liu, Kristen Hughes, Yanis Hernandez, Laurie Leach, Chelsea Malden, Kyle Reese, Geraldine Powell, and Stephen Morrison. Robert Fabricant and Jill Wildman are provocateurs, but they are also going to wrap up the entire day's conversation later on in the afternoon. There are many people and organizations without whom this event would not have been possible. Chief among them is the Robert Wood Johnson Foundation, our lead sponsor. We are not only grateful for their support for putting on this event today, but for the extraordinary work they do in building a national culture of health. We also want to thank the Gates Foundation, Autodesk, Buffalo Niagara Medical Campus, and SAPI Ideas That Matter. And our colleagues at AIGA and PopTech, Sustain Natural, the Massive Change Network, Doppler, and the Impact Design Hub. All of these organizations are taking on social issues in different but powerful ways. I personally want to thank Mark Randall for being the guy who said, why don't we get people together to talk about this? And Kyle Reese, who started this conversation years ago and has never lost his curiosity or his confidence in what design can do. And my co-chairs, Nancy Green and Li-Shan Huang, who were enormously helpful in designing this day, and from whom you'll be hearing when they moderate the Q&A session.